A new tool is shining a light on hidden cancer, and a Milwaukee surgeon is among the first in the area to use it. Ellie Nakamoto-White shows us how this FDA-approved medication works in the battle to save lives.
There are moments in medicine when doctors don't just treat disease.
So that's his tumor right in the middle.
They see it, sometimes for the very first time.
What it really gives you is a sense that a certainty and confidence in what's going on.
This glow isn't special effects. It's cancer, illuminated in real time by a new tool called Cytalux,
An agent that allows us to illuminate cancer cells during surgery.
And Dr. Mallory Hunt is the first surgeon in Milwaukee to use it.
There really isn't any other sort of agent like it on the market that allows us to really see any sort of cancer in the chest or other parts of the body.
Patients get Cytalux pre-op, where it travels through the body.
And what it allows us to do in surgery is to activate a little filter on our camera that lights up the tumors in real time.
And when the filter flips on,
the one that we use most frequently is a neon green, which is really cool.
Impossible to miss.
It is very dramatic.
And sometimes life-changing.
So I'm about 9 days out from my surgery.
Just ask Mark Unak.
I finished chemo about 2 years ago, and in the last year, that little nodule started growing. It went from 3 millimeters to 9 millimeters, which is less than the size of a pea.
Tiny and hard to find.
These are often very small when they're first discovered, and they can be buried in areas of the lung that we would never find if we were just looking at it with the robot and with the robotic camera.
Until now.
This is really game-changing for us. I would not have found this otherwise.
And because Dr. Hunt could see exactly where that cancer was.
We just took the little area of lung around it, nothing more than we needed.
That precision meant confidence.
This gives them eyes into what's really going on that they just never had before.
Now Mark can focus on chemo, and Dr. Hunt can focus on saving more lives.
We operate on probably 15 to 20 people a week, and I could find a use for Cytalux in almost all of them.
All because something invisible became visible.
When I think of this type of technology, I think of it allowing us to do things robotically that we never thought were possible. I just see this technology as a tool to expand the scope of the patients that we can operate on.
Thanks for watching this CBS 58 Sunday Morning Story. Subscribe here and make sure to tune in to CBS 58 every Sunday morning to see more uplifting stories like this. And check out our other playlists on YouTube. You'll find everything from Everyday Heroes to our CBS 58 Hometown series on CBS 58.